organizations. It is primarily around revenue integrity and charge reconciliation processes. So today, we're joined by Hal and Charlie from the Streamline team, and they'll introduce themselves as they come on board here. But I think kind of peeling it back a layer, some really good things to take away from this conversation is, agreeing that all of us today probably have different processes when it comes to manual reconciliation and cash that's, left on under the table. So Streamline has a solution in RevID, which is what we'll be discussing today, that's truly going to help automate that process. They use a specific extract that we have co-developed with them to be part of your clinical EMR and ecosystem and have those different alerts and triggers really follow to a queue for your users to address to show you, month to month, month to date comparisons, where your leakage possibly exists today. A lot of the organizations that I work with today currently have a lot of manual processes. I'm sure a lot of you could agree that the suspended charges report is something that's probably broadly used today at the organization. But when we go back a few years, Oracle Cerner has never had a solution of our own to help with revenue leakage. And we evaluated Streamline Health, and they are a really good fit. And you'll hear from one of our current customers today that is using this solution and the huge ROI that has come out of them using this native functionality and technology. So automation is a huge theme today. A little bit of housekeeping items. We love for the collaboration. We will save 15 minutes or so at the end for question and answer. So feel free to put those questions in the chat and we'll be monitoring those. And then also keep in mind too, that, as part of this, we'll be sending out this recording, the slide deck, and we'd be willing to do an ROI analysis with the teams today. So again, thank you so much for the time. Just wanted to kick things off here. We'll obviously save all the introductions because there is a lot of organizations represented here today. So we appreciate you guys getting flexible. So Hal, I'll hand it to you. Thank you for your partnership.
Thanks, Brian. It's a pleasure to be with you all today. Looking forward to hearing from each of you as we go through the presentation today. I've been with Streamline for about 9 years now and focused on partner relations. Been working closely with the Cerner Oracle team now for about the past 4 years. Have attended forum, the CommunityWorks forum last couple of times, and we'll be at the next forum coming up here soon. So may have had an opportunity to meet some of you in the past. In fact, at the last forum, Charlie, who's joining me, had an opportunity to present on how we're helping CommunityWorks hospitals to improve revenue performance with the automation that we're going to talk to today. So my background, I've worked on the hospital side of the fence for about 15 years, both on the acute and the ambulatory, including leading freestanding facilities, as well as managing physician practice environments. And then left and joined a consulting firm as a partner, which we focused on mid-revenue cycle again. Sold that firm in 2015 and joined Streamline. So it's a pleasure to be with you all and looking forward to I have an opportunity to meet some of you as well coming up soon. So with that, Charlie, would you please introduce yourself?
Yeah, thank you, Hal. My name is Charlie Thompson, and I have been with Streamline for a couple years now. My background, like Hal's, is both on the hospital side and the vendor side. And I come from a software engineering and development background, specifically in healthcare revenue cycles. So I've worked with the smallest community hospitals all the way up to multi-state national organizations, helping to develop revenue cycle software. So pleasure to be with you and look forward to the webinar today.
Thanks, Charlie. So you can see here, the focus is really going to be on charge reconciliation, automating charge reconciliation, and how that can have a significant impact in a CommunityWorks hospital environment. And as Brian alluded to, we'll hear from one of our customers today on how they've been utilizing it. I've been focused in this area specifically with CommunityWorks groups for about the past 2 years now. And so have 4 CommunityWorks hospitals now signed up in with the software itself. So what's the genesis of this? Where did this all come from? Well, Streamline Health has been focused over the past 30 years at introducing and bringing solutions that are designed to help with revenue foresight, mid-revenue cycle technology to give insight for our clients to understand where they can improve performance, such as in charge reconciliation, as we're going to talk about today. But in order to reduce revenue leakage and improve overall efficiencies within the organization, we certainly understand and hear commonly in talking with CommunityWorks leaders that margins are extremely tight, that resources are thin, and the ability to be able to do a daily reconciliation process across their hospital is extremely challenging, and oftentimes they're not even able to do it. So by introducing an approach that enables automation that can drastically reduce the man hours necessary to actually analyze on a daily basis the charge activity to ensure that all charges are being captured has been extremely attractive in that regard. So if I take, I'm not used to Zoom as much. Here it is. Okay, so one of the things that we wanted you all to kind of think about for a minute was just a quick question on what is important to a high-performing charge reconciliation process. So when we sit down and do our initial discovery with CommunityWorks clients, these are the types of conversations, these are the questions we're asking. We want to understand what it is that they're struggling with today. What is it that's important to them? What would they want to be able to take advantage of if they could? Obviously, to address this properly, you need all of the above to be effective within an automated process, especially with charge reconciliation. And why? These are the challenges that we're hearing. I'm sure that many of you can relate to these. It really falls into three primary buckets when we talk with CommunityWorks leaders regarding charge reconciliation. Either process in which there's a manual approach to compare posted charges to schedules or completed events, orders, tests, that sort of thing, and try to reconcile if there were any events or orders or tests that weren't charged for that should have been charged for. And then you get into some of the high volume areas such as pharmacy and laboratory, and some of those areas don't even have a comprehensive process. They might look very discreetly at certain areas just to make sure that there's some charge reconciliation going on. And it's particularly because of the lean staffing associated in CommunityWorks hospitals, where the managers or department leaders are often wearing a couple of hats, and they're not only patient facing, but then they need to spend some time doing this reconciliation effort. So it translates into kind of an inconsistent process for most organizations today, and we'll hear a little bit more about that from one of our clients in just a minute. The other bucket, so compliance, when we ask CommunityWorks hospitals if there was an ability to do a daily reconciliation and an opportunity to ensure that it was happening across all different departments, the resounding answer, of course, is yes, that they'd love to have that ability, because it's obviously critical with razor thin margins to ensure that every single one of the charges that you should be able to charge for is being charged for, and that there aren't things missing. And when we talk about what are the challenges that are stopping them from that, not only is it clinical or managers, it's also the IT side, that they have very limited resources in IT. So as they think about maybe they could utilize the reports, as Brian alluded to earlier, some of the late charges or delayed charges reports, and try to figure out, can they set up a way to be able to technology-wise better identify those. There just isn't the time. The resource is just way too limited. So what that leads to then in terms of the third bucket here is there isn't a way in many organizations to even quantify what might be missed. You can see what's being delayed, right? With the charges, you can run late charges reports. But that's only if that event is actually charged for, that's on that delayed list. If it's been missed, then it doesn't even make the list. So there's a lack of ability to be able to quantify what exactly might be missed. Now, there has been analysis. HFMA's done reports on this. I think Kaufman took a look at this as well, and they found anywhere from around 1.5% to 2% of charges are missed, of net patient revenue, I should say, is missed because of missing charges. Our experience in working with our clients, both CommunityWorks, and then we work with a number of larger health systems as well, is anywhere from around 2 to as high as 4% of net patient revenues being missed because of a lack or sometimes a non-existent charge reconciliation process itself that we can help them recapture by using a automation solution. So let's hear from Jessica Carter is this CFO of Crisp Regional Hospital. They are a 65-bed hospital in Georgia. They've been using our software for about 1 year now, actually just a little over 1 year. And she recently participated in a webinar and trying to get this to load. Now it doesn't want to load. Hold on 1 second, please.
We did have a.
Okay, let me share my screen again. I apologize for that. It was working when we were testing, but now it doesn't want to work. Here's Jessica from CRISP.
Charge reconciliation process. We went to Cerner about 5 years ago. We did create a process that managers had to work through because we understand the importance of charge capture. It probably was not the best because it was manual. It was hard to keep people accountable to that process. It's also very time consuming for our managers, and we weren't really sure they were doing daily reconciliations. We had created, when we first went live with Cerner, we did dailies for a long time, just to make sure that the system was built right, things like that. But then we went to managers had to turn in something weekly to do that. And, some were good with it, some were not. It was very a manual process to see were people doing what they thought was a true reconciliation, which you're not going to be able to do all that in a manual process like you can in automation. So that's a little bit about where we were with very reports out of DA2 and things like that with the managers to reconcile that on a daily basis, but more likely a lot of times it was weekly with some of our managers. We have a revenue integrity director who was, ultimately responsible for working with the managers to make sure that these were done daily, working with them when they did find things, because you do find things that, something is not generating charge. So they would work through that. But, it was, again, a very manual process. And as you all know, some of your departments have lots and lots of volume, like pharmacy and lab. And, those can be overwhelming for them to manage and know, are they really getting the charges in like they should? She was having to do that along with all of her other responsibilities, helping those managers try and keep up with their charges daily. So it was, sometimes it was probably inconsistent and sometimes probably not as accurate as it could have been. We did have a charge reconciliation process. When we went to Cerner about 5 years ago, we did create a process.
Let me go back to the presentation now. Are you seeing the presentation screen again?
Yes.
Okay, very good. Thank you. Charlie, do you want to take it from here and talk a little bit about how we help CRISP?
Yeah, absolutely. Thank you, Hal. So as Brian and Hal kind of alluded to, the automation technology we're talking about today is RevID, which is what CRISP and a number of other CommunityWorks facilities have implemented. And what RevID does is sits pre-bill and works daily behind the scenes and automatically is going to take away the manual work of the suspended charges report and all the other reports you're printing off currently, trying to see where your charges exist. And what it's going to do is ensure that every single charge is captured and reconciled on a daily basis by automatically comparing those clinical extracts to the charge data and preventing that revenue leakage at the source. By automating this reconciliation process, RevID helps to eliminate the thousands of manual hours, and it helps prevent those late charges and capture those missed charges. What it does is it works as an exceptions-based tool where the RevID is going to present to you. Once we get into the solution, I can show you how RevID will present to you the charge discrepancies. So these could be clinical events that are missing charges. They could be charges that are missing clinical events, or they could be a numerous of other ancillary values where there are issues with the CDM or things routed to the incorrect general ledger. So if on the next slide, we'll walk through some of the values that CommunityWorks facilities are finding with the solution. And so, first of all, there's a high level of collaboration. We've heard from several clients as well as folks in the industry that there seems to be a gap between patient care and administrative work. And what RevID does is help bridge that gap by giving a tool that helps, as Jessica alluded to in her clip, the collaboration of the managers and the revenue cycle department to where they can very easily and quickly correct some of the administrative tasks and get back to the thing that's most important, which is patient care. And that goes right along with where people wear multiple hats. I know at some smaller facilities, your managers are taking patients as well as doing administrative work. And so this really speeds up that time, as well as making sure that you're accounting for every charge and every dollar. As I mentioned, the intangible benefits that come along with that collaboration includes finding things that may be missing either in the supply master or incorrect charge master, or there could be things routed incorrectly. We have found several of those with our current clients, some amounting to $500,000 or more per month for one facility. And then as we'll talk later with our client success team and being a true partner with you and helping you to refine and maximize the use of RevID as an extension of your team.
Thanks,
So
Charlie.
with that, we'll see another clip of Jessica talking about some of these valuable and the adoption of RevID.
Yeah, so let me go ahead and bring that up now.
The other piece is also to make sure the IT resources, the IT has the resources to implement what you're, want to bring to life in your part of the world of the organization. So we took it to.
Hey, Hal, we can hear that, but we can't see it.
Edit it and said this is
no,
a product.
I apologize.
Really, the other piece is.
Let me come back to this and share. Thank you, Charlie. How about now? Can you see it now?
Yes, we can see it now.
Thank you.
IT resources, the IT has the resources to implement what you're, want to bring to life in your part of the world of the organization. So we took it to, once revenue cycle went through it and vetted it and said this is a product we took it to that IT governance, which is made up of IT, senior admin people, clinical people, and all like that. When my clinical team saw that, they're all, we want it. They instantly saw the value in what they were going to be able to give back to some of their managers, because it is easy to use. It is simple to use. And IT, you'll find there is not a large lift from IT, so it doesn't require a lot of work from your IT team. Streamline and work will do a lot of that in the background. So it's a pretty easy project or system to implement for an organization, because you're not asking for a lot of things, because IT gets pulled a lot of different ways, and they were able to put this on pretty quickly because it didn't demand a lot from them. So obviously once I went through IT, then we went to finance and all like that. But it was great acceptance from the very beginning when they saw it. They saw the value in it, and what they were going to be able to get back.
Okay, so let me come back to the presentation now. Are you able to see the presentation again? Okay, great.
Yes.
Thank you. So let's take a closer dive into exactly what Chris experienced. This was a case study that we developed with Jessica's help. And again, they're a 65-bed facility in Georgia, 115 million in revenue. We did hear that they had some reconciliation processes, all manual, in which they were basically comparing the events and lab and orders and all the scheduled activities with the posted charges each day, but had very inconsistent application of that. The revenue integrity leader was unable to really ensure that those were going on a daily basis. So by bringing in RevID, they were able to then automate that process. They were able, and as you heard, the clinical managers loved it because it saved them hours, and on average about 3 hours a week in each department. And now they could do 100% reconciliation every single day. So the impact for them was pretty substantial. They improved their net revenue by $1 million, essentially paying for the software in about 2 days or 2 months, 2.5 months. They had, again, strong adoption across even the busiest of departments. They had a 55% reduction in late charges. They had a 30% of rebilling was eliminated. And as I mentioned, they saved about 3 hours per week. And those are the tangible benefits that they had. And then I'll send out a link to this webinar, the full webinar, if you're interested in it after this. But Jessica also spoke to the intangible benefits of this, and that was the high satisfaction, the collaboration that emerged between clinical departments and revenue integrity when this solution enabled them to get it done in minutes rather than in hours each day. They suddenly became much more engaged and were very supportive. The ability then for the revenue integrity leader to have an enterprise-wide accountability network now and know if things weren't getting done and how to follow up and to ensure that they did get done. They also identified, as Charlie alluded to, some charges that were on the wrong encounters, which Jessica suggests they may have found, a month or two down the road. But with RevID, they identified it today. In the very next day, they identified it was an issue. It was the same thing of charges being routed to the wrong GL account. They identified that the next day. So she referred to those intangible because, again, she thought maybe they would have caught those later, and maybe they would have still been within a rebilling window at that time. But in this case, it's not being missed anymore. It's being addressed right now. So the ability for the system to immediately help them was very profound as well. So Charlie, do you want to walk through how the software actually works?
Yeah, absolutely. So from a high level overview, I'll give you how the workflow kind of works, and then we'll dive into the system. So what RevID does is it takes about 10 to 15 clinical extracts out of your Oracle system, and then it's going to match that up with the posted charges file. And then RevID is going to analyze that on a nightly basis among its algorithm and matching capabilities, and it's going to see if we have any clinical events or charges that are missing. If we do not for those particular encounters, then no action is needed and it moves on in the billing process. If there is an issue, a discrepancy, then RevID will flag that. And in the system, you will see those missing charges when I dive into that. So with that, I'm excited to show you what RevID looks like. And also, as Jessica had mentioned, and we've talked about before, the simple and ease of use of the system. And so, Hal, I think you have to stop sharing first, and then, yes, it should let me share. Here we go. So I'm pulling up RevID here, and I wanted to show you when you first log in what we call our average daily revenue. So I'm going to speak about this at a high level from a leadership perspective, and then also dive into what it looks like from a workflow perspective of a user. So right away, as the leader of Bluebird Memorial Hospital, my demo system here, I can see we use the stoplight colors, red, green, and yellow. Red, green, and yellow. And I can easily see how my departments are doing compared to what I expect them to be doing. So at first glance, I'm sure you could easily draw your attention to the infusion clinic and professional charges here, where we see we have posted about 50% less revenue than expected for the infusion department and 100% less than expected for professional charges. And so right away, I know that I probably have opportunities in these departments where there could be some missing charges that need to be accounted for and opportunities to be corrected. On the second half of this dashboard, I want to draw your attention to this remaining event with no charges column. So even in, let's say, emergency services where I've posted 25% more revenue than I expected for that day, then I still have 96 opportunities where I have clinical events that do not have charges associated with them. And so I'm able to easily see on a daily basis how my facility is doing, how each of my departments are doing, and where I can direct my staff. Now, it does get more granular. So you're able to drill into each one of these departments and see the same view for each cost center. And you can really drill in on the opportunities and the discrepancies that exist. So I'm going to show you what that looks like from the lab point of view, and then we'll get into the user workflow. So as you can see with lab, we posted about 6% more revenue than we expected. However, I still have 96 events, 96 opportunities. So as I drill into lab here, it's going to show me my 4 different cost centers that I have associated with lab. And I can see right away, I have 3 cost centers that I expected more revenue from. And for 2 of those departments, I have about 96 opportunities. So we're going to go into histology here, which posted 50% less revenue than expected, and there's 15 opportunities. So as a leader, I can click in and view these. And then also, this is from the user perspective. If I was the person in charge of reconciling charges for lab or the person responsible for making any corrections, I can easily see what my charge discrepancies are. And so what RevID does is it's going to, again, eliminate all that manual work, and it's going to show you the reds, which are the charge discrepancies, right here in the system. So you no longer have to sift through line by line to see what matched. We already know that these are the charge discrepancies that need to be corrected. So as you can see here for these different clinical events, for a procedure report, we have a stain or a slide, level 3s, level 4s, level 5s, all of these different clinical events that took place that you can get more information, that the user can get more information on by selecting this patient card that shows you the order numbers and the order details, as well as who the ordering physician was, what type of encounter it was, where they were when this was ordered. They can also see additional clinical event information and history. And then you'll see here that it says no charge items match this clinical event. And RevID is expecting a charge item for this clinical event. And so if I am the person responsible for correcting this, I would go into my EMR. I can easily copy the FIN number, paste it into the EMR, pull up this record, and make that correction. I then can select this record in RevID, and when I go to assign this task, I can resolve this task inside the system if I'm the person that's responsible for it. If I'm not the person responsible, but I need to send this to the person that is responsible to correct these, I can send this task out to the person that is responsible. Let's say this one is Hal, and he's responsible for correcting this one. And so I can select that, enter some notes, and I can send that to Hal. When I send that to Hal, Then under on the left-hand navigation pane, there's a task section. When Hal logs in and goes to his tasks, he'll see all of the tasks that are available for him for the charge discrepancies that he needs to correct. So he can easily click on this task number, see a very similar screen where he has the patient card and the clinical events history, and he's able to resolve this and attest in RevID that this is being completed. And so this is one way to keep track of accountability. And then the other piece to that is if you do not want certain people to have access to RevID, it is a role-based solution. So there are folks that do not have that. What you can do as well that I wanted to show you is that each of these tasks can be sent out as a report or a PDF. So if I wanted to select all of these and export them as a report or a PDF, I'm able then to easily send that to, let's say, the department manager or a department liaison that's responsible for that that maybe doesn't want to log into RevID, but the revenue cycle or revenue integrity team can look at this. They can send those out and have those easily corrected. So that's high level from data visibility and the workflow of the solution. Of course, we have robust reporting. We're able to create exceptions. We spend a lot of time during implementation understanding how each department charges so that we can account for any nuances. We can account for manual charge entry, and we can account for the different ways in which departments charge for things or expect to see charges. For instance, we can build in lag times for lab or the ED, whether that's 3 days or 2 weeks, depending on what the clinical event is. RevID has the capability and the customization to present to you the charge discrepancies that are going to provide that opportunity and be the ones that are needed to be seen. So Hal, I'll turn it back over to you.
Thanks, Charlie. I will go ahead and share my screen again. And I know I've seen a couple of questions posted in the chat, and we'll just wrapping up right now. So we'll then get to those questions that you're posting there. Thank you for putting those in there. Wanted to conclude with two thoughts on this. Number one, as Charlie just mentioned, that RevID has intelligence in the software. So it can be set up to look for a posted charge when that posted charge should be there. So if there is going to be a delay associated with when a test or an order or something is administered, and when a charge should show up, we can build that intelligence into the system. In fact, one of the key elements when we're setting this up is that our client success team and our installation teams meet with the department leaders and identify if the charges that are being created by those departments are charges that should show up on the next day, or if they will be delayed a day or two, so that we can, right from the outset, set up a system that will be intelligent and present missing charges, when those are appropriate. So we're not having the departments chasing down false positives because the charge shouldn't be there yet anyway. So that client success team and the installation team works very closely with the departments. In fact, on the IT side, the setup of this is actually pretty straightforward, and it's not very intensive on the client IT side at all, given the domain structure with CommunityWorks. And in fact, a little bit more time is actually spent with the clinical departments, making sure we're mapping this solution exactly the way it's going to best fit for each one of the departments. But then that client success team becomes your long-term partner. We work with every single one of our clients on a monthly basis. We're generating reports. We're helping them see what charges have been reconciled, if there have been GL mismatches or other issues going on that need to be corrected. We're working through all that. We're helping them identify of those charges that were recaptured now. They can then do the interpretation on their end to determine what the net impact was associated with those charges that were being recaptured for them. Of course, on the inpatient side, some of those might be tied to a DRG where there may not be a financial change in the case, but in those cases, our clients want to know that they've captured every appropriate charge, even on those cases, but certainly on the outpatient cases where there is the opportunity to charge specifically for those tests and other things that are being done, that we're capturing all that as well for them and making sure that they've got a way to track that back. And then we also have quarterly, what we refer to as a community gathering. So all of our clients are get together on a quarterly basis, virtually, of course, to be able to talk through the challenges and opportunities that they're facing, help us to refine how we can improve the software to help them better identify opportunities for improvement, to drill in deeper into some of the areas like pharmacy when you start having volume levels and things of that nature that start to impact charges, making sure that we're getting that as accurate as we can. So work very closely on a long-term basis with each one of our clients going forward. So I'm going to pause at this point and open it up for conversations and questions and any that you all have as we conclude, before we conclude for today.
Yeah, Hal, this is Brian. Not sure if you have visibility to the questions that have come in. There was a couple questions, I'm guessing, in regards to Jessica and the Chris Regional story.
Yeah.
With the increase in gross charges, what was the actual payment received, increase in reimbursement on average? Were they able to maintain a consistent clean claim rate? Was there an increase in their denial rates and underpayment tracking metrics?
Yeah, all good questions. So the gross charge level is going to be, when you convert that to net, it's going to be based upon contracts and things of that nature. So that they're able to work through that on their end, Jessica's team at CRISP. And then in terms of going forward, the charges that we're helping to identify that are being recaptured are for specific events that have in fact occurred. So it's not impacting denials. It's not creating issues whereby there's a sense of that there's an overcharge or something like that going on here. It's all validated, and that's why each of the departments, as you saw, has that opportunity to validate to make sure that in fact that should be charged for. So that happens to ensure that we can have that clean claim going forward relative to that.
And Hal, I would just like to add one thing to that, which is on the gross charges and the net reimbursement. Hal just mentioned our client success team. So one of the things that our client success team does with the organization, like with Jessica, for instance, is we look at what the payer mix is and communicate with you on what those reimbursements are so that we can calculate a true net reimbursement. So typically it revolves pretty close to your net realization rate. So there is, right away in the lights on network, there's an impact to gross charges. And then we're able to calculate what that net realization is going to be from the increase in gross charges and present that so that it helps keep us accountable, and as well as, the hospital, the organization is able to understand what their actual net revenue improvement is.
Thanks, guys. The other one, can we get a sampling of the product to see if there's a need before we commit to a contract?
The way that we work on that is to help by taking a look at what your reports might suggest are going on in your organization, and give you the opportunity to talk to like a CRISP or someone else about how they're using it. But in order to get a sampling, we'd have to set up data extracts out of your particular facilities, which at this point would be somewhat challenging to do. But what we can certainly do is identify within some of the reports that you have today, and through conversations with other members of the organization that are actually doing the reconciliation work, if in fact there's with the likelihood, and then in our experience, we have found that, on average, again, it's going to be somewhere around 1% to 4% of net patient revenue that our clients are finding as incremental gain in using the software.
And then I see another comment here, Brian. Increase in charge reconciliation only translates to cash if there is a percent of charges contracted for rural providers. So any increase in gross may not make it to cash. That's correct. So not every increase in gross makes it to actual cash. But what we can tell you from our clients' stories, for as Hal alluded to, we see a net revenue improvement anywhere from 2 to 4%. For Chris' story, the $1 million that you saw is a net revenue, not their increase in just their increase in gross charges. So it is net revenue cash impact that Crisp and our clients are seeing. So we do that calculation to get to that true net cash impact for the organization.
Thanks, Charlie.
Yeah, and as part of your participation today, we'll go ahead and put together a business impact analysis for each of you, and would be happy to get together with you and go through that. And at the same time, unpack this a little bit more. We gave a very high level presentation today. We'd be happy to talk through in more detail with your teams and show your teams how this is working. And as a follow-up to today's conversation.
Then the next question is it normalized to the product, or does it have a net patient revenue impact for volume growth or other strategic initiatives? So what we take a look at with our client success team is the tasks and the reconciliation that takes place in RevID. So it's not we're not taking into account anything that would happen outside of RevID. So we're looking at specifically what has RevID presented to be reconciled that has been missed. And then of those that were corrected, what is the net revenue impact for that, for your organization?
So does it have any intelligence around what is typically seen with a certain procedure? Or is it specifically for what's been ordered or what's been documented in the chart?
It does have intelligence for that. So RevID does have expected charges as well. So
Okay.
we're able to build intelligence. Let's see, if you have a procedure that takes place and you're expecting a couple different supply charges and you're expecting maybe some drug administration charges, whatever encompasses that procedure, then RevID will flag those if it's not present.
Do you have a way that if we knew there's a certain charge that they always miss or, miss often, that we can tell you those certain charges if it's this procedure, then look for this charge?
Yes, and we can build that and flag it every time for you.
Perfect. Thank you.
Thanks, Madonna, for the question. Yeah, feel free to come off mute if you're not shy and voice your feedback. We'd love to hear that. So we'll stay on for another 5 minutes or so, but feel free to come off mute if you think of anything or just have questions in general. We will get the recording out, yes. And the slide deck.
Yeah, and as noted down below, we'll be at the CommunityWorks Forum coming up here at the end of April, and Jessica's actually going to do a brief presentation on their use of the software. She'll be at that meeting, so if any of you are planning to attend, be happy to help coordinate a opportunity to meet Jessica and hear how they've been using the software.
All right. Does anybody else have any questions before we depart here? Did we answer all the questions in the chat? Just wanted to make sure.
Yes.
Okay. All right. I know we have about 12 more minutes. If anybody wants to hang on and ask any more questions, we can kind of hang on for a few more minutes. If not, Hal, Charles, Brian, you guys good to go?
Yeah. Yep. Thank you all for participating today. And, if you think of questions later, let Derek or Brian or someone else on the Oracle team know, and we'd be happy to address those. In the meantime, we'll follow up with you on a business impact.
Great.
Yes,
Thanks,
thank
everybody.
you all.
Thanks, Streamline. Really appreciate your collaboration.
Absolutely.
Thank
Thanks,
you.
guys. Have a
Take
great
care.
day.
Thank you. Thanks for everybody who joined. Thank you.